It's Professor Didier Letourneur. Hello, Didier.
Hello.
Welcome. From INSERM, he will talk to us about the first results of the NanoAthero project.
So. I can talk with the microphone, it will be easy. So thank you for the introduction, Panos. Thank you for all of you. It's a great pleasure it's not the first presentation, but it's the first time that I'm presenting this European project. So I have the pleasure to be the coordinator of this project. And the aim is to use nanomedicine for both imaging and treatment of atherosclerosis. So I will make any introduction about atherosclerosis and the importance of treating atherosclerosis patient. But what I want to show is the results of the collaborative program for the development and initial clinical feasibility of using nanotechnology for both the imaging and treatment of cardiovascular disease. To have this goal, we set up a large consortium with 16 partners. So we have inside 4 industrial partners, 2 clinical centers. There is 1 foundation for clinical medicine that you know because it's CLINAM. And then we have also 6 research centers. So you can found them on the map, but the best thing to think about this map is not the location of the patient, but of the group, but the expertise of the people. So we are really ranging from the design of a material to the clinical application with consideration also for ethics, regulation, and so on. In fact, we have designed. If it's moving, yeah, we have designed several types of nanosystem for the treatment of cardiovascular disease and also for the imaging. So the concept is to use the size, the nano size of this system and to have the imaging agent or the drug either inside the component or outside at the surface, and to have in some condition a targeting moiety, not always, a specific design of the shell, and to try to target what we want. So we want as aim mostly to target the thrombus and also the plaque. And for that, we have selected several types of nanosystems that were available with a partner. So on ranging from the composition and from the size of the nanosystem. So we are dealing with a small macromolecular system until classical liposome formulation, ranging with lipid composition, natural lipids, small micelle, and iron oxide particles. So I will not present everything in less than 15 minutes, but I want to emphasize that we were having all this nanosystem in the project to select the best composition to have the right impact for either imaging on treatment. So we were really having the design and characterization of the nanosystem until the clinical application in 5 work packages, also dealing with toxicity and, of course, training and dissemination of this result. So our purpose was to target the thrombus and to target the plaque, and for both to have the imaging and treatment. Not combined, but imaging or treatment, so thrombus imaging, thrombus treatment, molecular imaging of the plaque, or plaque treatment. So let's give a few examples of this. So let's start for plaque treatment. In fact, in the PhD of Arm, so he was able in working in University of Twente, so you know Gert Storm, which is in the room, so to design and to evaluate several drugs and to check the efficacy of this drug about different parameters. So with this selection, we were able to have drug formulation in 1 nanosystem, which was a liposome construct, to have evaluation of, for instance, encapsulation efficacy. So you can see that it's ranging from 2 to 40%, so the efficacy can be different. We have also stability experiment over a year. So we had several drug formulations for one nanosystem, and we were able to set up a full range of criteria. In fact, 7 criteria that were fulfilled for all the nanosystems we wanted to evaluate. So they were ranging from pharmacochemistry product characteristic, ingredient, manufacturability, stability, and also adding in vitro and in vivo experiment together with this construct for efficacy, pharmacokinetics, and toxicity. All these nanosystems were all checked for these 7 parameters. One example was a liposome loaded with a drug, which was already prepared. So it went to a GMP formulation, pharmaceutical formulation to be able to enter clinical evaluation. So the GMP formulation was evaluated in preclinical model, especially in rabbit. And after that, after positive answer, they were able, with Eric Stroes in Amsterdam, to test in human the liposome loaded with a drug for pharmacokinetic profile, for drug delivery, and to evaluate first the first attempt of efficacy. So to make a very long story short, so they were able, so these 2 partners, to demonstrate that the liposome loaded with the drug accumulate in human atherosclerotic macrophage under intravenous administration in humans. This is a very good demonstration. The pharmacokinetics were obtained, the safety was obtained, and the accumulation, the delivery of the drug was demonstrated. So far, not the efficacy of this system, so they are still working on different composition of drugs and different formulation of the nanosystem, which work is still going on. So another example about plaque imaging, again, screening about the 7 parameters. So this is mostly the work done by Christoph Alexiou group in Erlangen using ultra small iron oxide particle covered with dextran. So they were able to check everything, also using also the expertise of several partners. One important thing is complement activation because the toxicity issue, especially with iron oxide particle, which is already described. So they were able to show that it was no CARPA activation. So this has been done in Janos Beni, a laboratory in Hungary. So no CARPA activation at all on this formulation. So this is going to GMP formulation at the moment, and we are starting to think about using this for clinical application, again, with preliminary data in human with a group of Eric Stroes. So thrombus imaging on treatment, few words in the remaining time. So we were able to have a targeted nanosystem, and the targeting was about P-selectin. P-selectin is expressed on the thrombus formation on platelet. So when platelets are activated, so they express P-selectin. P-selectin is also expressed when you have activated endothelial cells. So we were able to have a ligand able to target the thrombus or to target activated cells. These results were partially published already in this paper, but I want to illustrate some of them. So first, the targeting with a compound which is fucoidan, a brown seaweed extract, in an in vitro assay under flow condition, venous or arterial condition. By grafting of a fucoidan, you can observe really much binding on recombinant P-selectin, either in venous or arterial condition. In platelet aggregate under flow condition, again, a better binding when you have the targeting with a fucoidan. Still in vitro, but under flow condition. In vivo, the same thing was observed when fucoidan was loaded on the surface of iron oxide particle, we were able to detect in vivo in a rat model the thrombus by MRI because this iron oxide particle was able to be visualized in this condition. So, in fact, we have developed this targeting either from a macromolecular assembly, also from nanoparticle, even from microparticle, always with a positive detection of the thrombus using this, either by molecular imaging using radionuclide, especially technetium, MRI, or combined for microparticle. Here is an example. Here you can clearly see by SPECT-CT imaging the detection of the thrombus here. So now we have finished also GMP formulation of this compound. So everything was done. So we are preparing the dossier for clinical application, and we expect to have the clinical trial at the end of this year or beginning of next year. So which is written here. So we are going for clinical application with this compound. A last point is about targeting thrombus on treatment, because we have a targeting which can be observed here. So we have really targeting in vivo in this mouse model as compared to non-targeting. And the efficacy also in vivo is also observed when we have a loaded thrombolytic agent, which is TPA. So this is very promising still in mouse model, but we will be continue for thrombus treatment again after that for GMP formulation and if it's possible until clinical trial. So, of course, to conclude, we have also deal a lot with ethics, dissemination, with more than 20 publications. There is also one patent and a large diffusion, large training of students. Many PhD on postdoc were involved in this program, which make the story very interesting. We have also collaboration, many collaboration between our 16 partners, which is also very important for the training of students coming from one lab to another one. And I would like to thank you for your attention with also this prize about the NanoAthero art.
Thank you very much, Didier. It was a very good presentation. I would like to hear some questions. Yeah, Professor Mogimi.
Thanks, Didier. That was a very nice talk, and congratulations on the NanoAthero achievement. You mentioned your testing in the humans, and I think none of the animals can replace that. And if I understood correctly, you said that you haven't seen any therapeutic efficacy yet.
Yes, absolutely, in the liposome formulation.
So my question is very simple. Why?
Why? There are several issues. One is the design of the study was done mostly for pharmacokinetics profile, safety profile, also drug delivery, which can be improved, but it was only 2 injections of liposome formulation, and then the follow-up only with the inflammatory assessment by PET imaging. So we don't think that 2 injection dose could be enough to really treat a plaque. Perhaps we need a first screening of the plaque, do liposome enters plaque in humans. So we have many questions. And then, of course, the loading of the active drug is also a main issue. So, but using this clinical trial, we learn a lot about what we don't know and what we have to follow. So we have to follow the drug. Can we label the drug? And can you assess in human the amount of drug which is really loaded on the plaque? Can we check the plaque before loading the drug for permeability on this issue? And can we have also a better efficiency with other type of drug? Because I said we started with this because the drug formulation was already available as a GMP form, but we can improve probably, and this is mostly the work done behind you, and we have new formulations that can be really much efficient.
But what was the criteria for the patient selection? I mean, how did you choose the patients? Were they on any specific drugs that could have, had an influence on this dosing that you're giving, or, I mean...
Yeah, it's why the selection of patients is very important. So the selection of patients was designed because it was under atherectomy, so the patient could remove the tissue, which was the main issue. So the patient were planning to have the pieces of a plaque removed, and this is very convenient because we could inject the formulation on to see if we have delivery. So this was the main indication. These patients were in any case for under atherectomy, so to remove the plaque. So, but of course, the treatment, the age, the condition of the patient, the addition of other type of drug is very important. So we are learning that, and we are moving also in the direction like personalized medicine, but really to focus more about the most efficient way to deliver the nano system in this patient according to the plaque criteria that we can have before injecting the drug. So we need also most imaging modality to do that. On iron oxide particle or other nano system can be interesting for pre-screening for that before treatment. Yes?
So I would like to ask about your iron oxide, so
yeah.
dextran-coated oxides. So what is so special about them compared to this what is on the market, was on the market,
yeah.
or was shown in literature?
Yeah, in fact, they are very similar because you have mostly a dextran or carboxymethyl dextran coating. But as PEG formulation, and you have seen a presentation of Scott by McNeil a few minutes ago, the density of the grafting, the length of the molecular chain has a great influence of the pharmacokinetic profile interaction with protein. So the molecular weight can be different, the substitution, because you can have carboxymethyl group, the density of the grafting on the formulation can be different because it's precipitation of dextran with a solution of iron, and this formulation can be different from vary, and stability can vary from batch to batch or from formulation to formulation. So when you have iron oxide particle in the literature, you have many types of iron oxide particle. So some were really wrong, so some were in clinic on we were having adverse effect, but you don't have to say all these iron oxide particles are bad or are good. So these formulations are really related to the preparation of this, preparation stability of this. But you can modulate with the chemistry a lot.
Will you compare it to something commercially available already?
Yes, but the problem also is they are not yet all accessible, or there are some where withdraw from the market, so it is difficult. And especially if it's all product.
Okay. So, Didier, if I may ask you a question very fast, because we are running out of time. The iron oxide nanoparticles that you are using, it's Actilis that you are loading?
Yeah, it's not in the presentation, but there is one poster from Erlangen Group where they graft TPA Actilis on the iron oxide particle. So they are working on it. The presentation was only with a fucoidan loaded with another particle. But you can use it either by binding of TPA or grafting of TPA. This work is going on.
Are you close to this clinical trial?
Not yet, not yet. It's still mostly formulation on validation, optimization with an in vivo model so far.
So this will be the only clinical trial that you plan?
Yeah, yeah. In addition to what has already been done with liposome.